What's up, beautiful people? Another day, another study. And this is my favorite type of study to bring to you, studies that compare lifestyle interventions to medication. So, previous studies have found that both intermittent fasting and meal replacement can be effective ways to help people lower blood sugars and diabetes. And so, this study combined the two. It took a 5-2 fasting plan, which is you eat normal calories 5 days, and then 2 non-consecutive days, you have very low calories, usually around 500 calories. And they had a meal replacement, so the meal was made for them. And they compared that to two first line medications, metformin and Jardiance. And what they found was that the 5-2 group actually improved their blood sugars more. They lost more weight. The 5-2 group also showed improvements in waist circumference, blood pressure. And this is really exciting because this was a randomized controlled trial, one of our gold standard trials, and it found that the lifestyle intervention could hold its weight, no pun intended, compared to two first-line medications. And the authors suggested that for people who are newly diagnosed with diabetes, that this type of fasting pattern can be provided as an alternative. What's also really great is that they didn't show significantly more hypoglycemia with the fasting method. Now, if you are going to try this and you have diabetes, please talk with your physician. There are certain medications that increase the risk of hypoglycemia if you start fasting.